Well, Alec, thank you for being here with us today. I am very excited to talk about this topic and, your life as a provider and how you got into the chronic pain space and how the hell you understand patients so wonderfully. So I'll give you a moment to introduce yourself and we'll get started.
Yeah. So thank you so much for having me on here, Samantha. Yeah. So my name is Alec. I'm a primary care provider from practicing in Southern California right now. And been down here for about a year and a half, originally from the Bay Area, from Oakland, California, where I kind of got started with my practice and then moved down here. Kind of got started in the healthcare field. I would say I was really drawn to it in 6th grade. I had a friend who unfortunately had cancer in his leg, and I just accompanied him to one of his physical therapy appointments, and I just remember thinking, "Wow, this is so cool. We can kinda use the kinda move the body in this way to help him heal and get back to, a area of functioning that really works for him." And it also involved just listening and communicating and interacting with people, right? Not being behind a desk. And so I kind of fell in love with the healthcare field around that time. And then as I got older and learned about different areas in the healthcare field, nursing, nurse practitioner, PA, doctor, um, after I got out of college, I was like, you know what? I kind of want to be more at the intersection of where the decisions are made and help to care for the patient kind of more holistically. And so I decided to pivot into the NP field around that time a little bit after college and just kind of been doing it ever since. But I feel like the interest in health, the interest in healthcare and communicating with the patient and connecting with the patient has always been my number one driver for getting into the healthcare field. And I'm happy that I can practice that today as a nurse practitioner.
And that is what drew me to you because I know I had told you this already, but one of the first videos of yours that you shared on Instagram, I was like, wait a minute. I had to listen to it again because I'm like, did he just understand? And it's one of those things where just as strictly as a patient, it's so refreshing to hear somebody, validating what our experience is because I know it's not just me and not just, chronic pain, but in the chronic illness space that having a provider really do their best to understand because it's not always easy to understand where someone's coming from. You might understand it like mechanically where their pain is coming from, but what that experience actually is for the person, it varies and it can be really hard to understand if you're not living that. So, kudos to you for really working as hard as you have to get to a place where you can understand that because that's not easy for you either. I can imagine you want to just say, here, do this, fix this, it'll make it all better. And that's not always the answer. Very rarely, actually, is that the answer.
Well said. Well said. Yeah.
Was there a moment where, like, besides what you had mentioned before about like viewing chronic pain and, how that might have changed your views on things, what was that like for you?
Yeah, so it was pretty early after I had gotten out of NP school and I was practicing at a clinic, and I was seeing a lot of chronic pain, a lot more than I would have thought, given
Mhm.
what I was kind of educated about, and I knew that it had existed. And so I was seeing kind of patient after patient, and was trying to manage with medications and referrals and getting imaging and trying to do the whole thing that we had been taught to do, right? And then I was like, "Okay, nice." Like, if these were board questions, I got them all right. But the thing is, then they kept coming back, and it was like, "Okay, well, I guess,
That
it
didn't
hasn't
work.
really gotten much better." Yeah, I guess we're
Yeah.
kinda managing it, but, like, "Okay, cool, nice." Like, ibuprofen helps a little bit, but wait, we can't give you that for that long, right? So let's maybe not do that. And so it just got to a point where I remember I was treating a gentleman, and we had tried a bunch of different things that weren't working for him. I sent him off to pain management. They sent me back with, a laundry list of, "Hey, consider these medications," and it was every single medication that has ever been shown to decrease pain. And I was like, okay, gotcha, gotcha. We've tried a lot of these, and they all come with side effects. And he's going to physical therapy, and that's helping him manage a little bit, but we're not really getting much better." And I'm like, "Is this just the fate of these patients?" Like, we have so many patients who are living with chronic pain, and they're not getting much better. We're trying to manage their pain, really just trying to minimize side effects, right? And I was just getting super frustrated. I was like, I feel hopeless as a provider because I can't help this person get better. And I was like, there has to be something more to this, right? And so I just went on a really deep dive and started studying chronic pain, chronic illness a little bit more or much more, and diving into the roots of this and just kind of realized that there's this whole world of understanding that we hadn't really been taught in our NP training, medical training, right? There's very few hours actually dedicated to learning about chronic pain, which you would expect there would be more when you have, 24.3% of US adults living with chronic pain, right?
Yeah.
So anyway, so I just kind of got to this point and came to this head where I was like, I have to learn more about this if I'm going to feel at all comfortable treating this in the future. I just hated how I felt and I hated how my patients were suffering. But then as I learned more, I was like, I can't, I fell in love with it. I was like, it's complex, but it is fascinating. And I feel like this is an area where I can help a lot of people and honestly a lot of providers who are in a similar situation to me. And so that's
Yeah.
kind of what got me into the field. And I've been
Hmm.
hooked ever since.
Yeah, it's so interesting to hear the provider side of that because I think as frustrated as we are as patients, and we're only seeing our pain and what we're feeling, that sometimes we're unable to see the frustration of the provider, or we maybe misinterpret that frustration like at us as a patient and not just at the situation. And that's where that communication barrier can really make or break that relationship between the patient and provider. And from what you're saying and my own experiences, I feel like that's something that's so avoidable by just having better communication skills on both ends, where the provider to understand, like, okay, the patient's in pain, they might not be conveying everything the way that I wish they would. And it just all goes back to, really, I feel like everything I say, I'm like, it comes back to communication, but really it does. And, we're frustrated, you're frustrated, everybody's frustrated, and we all tend to shut down when we're frustrated. And that doesn't really sound like that's something they teach you in medical school.
No, no, and we're made to feel like we're this expert, right? We need to know
Yeah.
everything. We have to, and so that can create frustration on our part, right? And like you said, projected maybe at the patient being like, well, I'm
Hmm.
doing it how it's supposed to be done, so it must be something that the patient's doing.
Yeah.
Or, and then it leads to this discrepancy in expectations because I'm not being open and honest about the limitations of my knowledge and what I don't know, right? We're not told it's okay to say, hey, I don't know what's going on here, but I'm going to do my best to try
Yeah.
to figure this out with you, right? How many times has a provider said, I'm not sure what's going on here, but I'm going to
Hmm.
work toward that, right? We're supposed to be like, oh, no, we're going to try to order this test or we're going to order this scan or get this lab.
Hmm.
And so then it creates, again, this gap in communication and in reality.
Yeah.
And so I think you touched on it beautifully is when I was starting to learn more about chronic pain and chronic illness. And I was like, okay, this is really fascinating. Let me go and put this out there. I
Hmm.
realized very quickly, oh man, we have to meet the patient where they are and make them
Yes.
feel understood
Yep.
before we can seek to be understood. And this is something that I teach every one of my students that rotates through with me. I tell them this all the time. I said, you need to seek to make the other person feel understood, then seek to be understood. And this is just best practice communication in any situation in which two people are trying to come to an understanding or an agreement. Right? Because if
Yeah.
the person doesn't feel understood, why would they want to hear you out? Why would they want,
Yeah.
then we could just get into this kind of battle of like, hey, I don't feel understood. So I'm going to come at you and then I'm going to try to force, this referral or this medication down your throat. And I'm just going to kind of throw it over there and cover my ears and hope it works. Right.
Yep.
And if they take to it and it's like, no, you can be the smartest provider in the world. You can know everything there is to know about medicine. But if that person doesn't feel understood, then it can all go to waste. Right. So
Yeah.
yeah, I could go off on a whole tangent here. I kind of already
Yeah.
have, but,
No,
but
it's
that's
okay. I'm sitting
it.
here like, yes, we need more
Yeah.
of this. Like, I am so glad we're recording this because this needs to be replayed over
Yeah.
and over and over
I
again.
agree. Let's get it out
It,
there.
it's such a thing. Like, in a chronic illness space, and as I have grown as a patient and with my confidence on saying, like, yes, I'm okay with that, no, I'm not okay with this, or I think you misunderstood me, like, there are times where I completely shut down. And it doesn't happen super often. It's usually when I'm well past my breaking point and I'm just like, I don't even care what happens to me anymore. I'm just done. And usually that's where like my husband or my mom has stepped in and been like, hold on, don't leave yet. Like we have to, I'll talk for her right now. And it's like, I've been in situations where I've had somebody, I go into the appointment, I'm fully prepared, and I'm like, okay, I want to touch on like just these three things. There's like 25, but these top three are the things that I really, really want to talk about. And one sticks out to me where I'm like, I'm going to be honest. Like, I am so fatigued right now. Like, it is, I feel like I have this extra gravity like in my feet and it's just pulling me down. And like, I can't even like lift up my feet to walk. I can't, my cognitive dysfunction is so bad right now. It took everything in me like to get to this appointment and tell you about this. And I see him writing things down. So I'm like, okay. And he's like, "You got your blood work?" And I'm like, "Yeah, I did," whatever, looking at it. And he's like, "Okay, so I'll see you in 3 months. You can get more blood work done." And I sat there and I was like, wait, what? And it was like the one time that I'm like, you know what? I'm not going to say I'm a little tired, but I'm okay. Like I can get through it. I'm like, nope. Don't do that to yourself. Don't gaslight yourself in this situation. Like, be honest and see what they're willing to maybe run an additional test or, kind of talk that through, like more about what that fatigue is really feeling like. And he just was kind of like, all right, yeah, we'll see you later. And like walked out of the room. And I was so dumbfounded.
Mhm.
And that was one of the situations where my TSH was in the 40s.
Mm.
That's why I was so dang tired. And I'm like, I had to ask and go and take all this extra energy to be like, can we please do something? And that's that piece of things where I'm like, the next appointment, I don't even want to say anything. I'm just like, write me like refills on my prescriptions and I'll do blood work again 3 months and go away because why should I say anything? You don't listen to me anyway.
Mhm.
And when you go into the realm of chronic pain, like you're past just chronic illness and now you're in chronic pain, it's a whole different animal of people coming in to say, I feel this level of pain. This is where I'm at. They're like, well, you got here today. Like, your hair is done or you're put together or, you're still working, right? So it can't be that bad. Granted, that's an extreme situation, but we hear a lot of that happening. And it's not fun for anybody in those situations, but especially not the patient who has done everything they can to get to that appointment. They're like all the eggs in that basket, really hoping for something, and you walk away so defeated. You're like, why did I even bother?
Mhm. 100%. We could pick apart just that single case. We could pick that apart for hours, right? All the
Yeah,
different
yeah.
so many opportunities for just like, "Hey, my feet are really heavy." Took everything for me to
Mhm.
just get here. My mind goes, this is an opportunity to commend the patient on just coming in. Wow,
Yep.
that sounds really difficult. Like, I
Mhm.
just want to say I'm proud of you for making it in today, right? Bam, we're connecting. They feel
Yep.
understood on an emotional level, right? That like, and that took how long? That took like five
Not
seconds
even
to
I was gonna
that.
say not even 30
Yeah, not
seconds.
even 5 seconds. And so
I
I
feel
know.
better. Thank you.
Yeah, yeah. It's like it can feel as providers like this is just extra fluff, right? The
Mhm.
patient is in here for me to solve their problem, and so then like I'm going to go down my little decision tree. I'm going to beat 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 down my algorithm and like spit out a diagnosis, and then like a treatment plan. It sounds like your provider didn't even do that. They just said see you
Nope.
in 3 months. But they not even what I would consider to be like the bare minimum in that situation.
Yeah.
But that's often where we kind of drop the ball. And I would say in that situation too, like, okay, getting some thyroid testing when someone is feeling super fatigued is not that far out of left field. And then you have people that are feeling this way, and then all of their labs come back normal. And then what
Yeah.
happens? And then they
Yep.
start to feel like, okay, well, the labs are normal, the tests are normal. So it must be you that's the problem. Right. And then the patient is gaslit into feeling that way. And we just
Yeah.
get down this whole rabbit hole of invalidation where someone came in with a problem and our system is just making it worse. Our communication
Yeah.
is just making it worse. How we're trained, everything. I mean, we could go down a whole a whole thing
We'll
here,
be here
but
all day if we
yeah,
start doing
we'll
that.
be we're doing a 3-hour podcast today. Is that right?
Yeah.
Might be longer, but yeah, I appreciate you sharing that story because it is just such a good look at what a lot of patients are going through, and it's
Yeah.
just not really acceptable.
Yeah, and I know, and I see, the last couple times I've been in the hospital and I see the hospitalists come in and like you can see the burnout. Like I can see it. I get it. Like you don't need to explain it to me, maybe to somebody else, but like I do understand it. But there comes a point where I'm like, I don't care. And I mean that in the best way possible, but it's just like what you have going on is not my priority right now, right? Where it's like my priority is to communicate my needs and then get the care or the next steps needed for me to feel better. So I can move on with my life and go actually maybe live my life. But that said, I know that unfortunately, the burden tends to fall on the patient to learn the communication skills, to be able to kind of brush off some of the um, things that happen in appointments to say, okay, that wasn't the best, but I still got something. So let me keep moving forward. But I know that there are pressures and there are things that you all feel as providers that is like systematically an issue where like you as an individual can't change it. Like there's nothing you can do as one person to make that difference, right? But the things that you can do are what you're saying of learning how to speak with the patients, learning how to understand the conditions and how that affects the body. But what, as a patient, maybe are we missing that we could possibly be more open to understanding that our physicians and our providers are actually going through? That if we maybe are a little bit more open to understanding that, we could break down some of those barriers. That was a really long way of asking a short question, but
Right.
hopefully you knew where
Yeah,
I was
yeah,
getting at.
yeah. I got it, and I actually think patients do a really good job of knowing this already. Like, oh, they'll come in and be like, "Hey, I know you're super busy right now. I know you only have so much time, right?"
Hmm.
And so I think there's a whole lot, but I will say a couple of quick things is just nowadays, especially with the my portals, the my charts of the world where patients can
Hmm.
actually message the providers directly. A lot of institutions are requiring the provider to respond to those messages while they're also charting, while they're also putting in, you know,
Gosh.
the diagnoses and treatments, and we have to do very thorough charting, and then there's also quality improvement measures,
Hmm.
which are all based in good reason, right? We want to make sure everyone's getting their colon cancer screening and their breast cancer screening and their pap
Hmm.
smears and everything like that, and it's just a way of tracking that. But sometimes it might be, "Hey, we have a 30-minute new patient appointment. It took 15 minutes for they came in 10 minutes late, took 15 minutes for the MA to room them. Now technically within our
Hmm.
time 5 minutes, and now I have to do a
Yep.
physical. I have to all about all these quality improvement measures. And odds are the person isn't coming in here just to get a physical, right? This is their new patient appointment. They're probably coming in
Yeah.
because something's wrong. And then now they have
Yeah.
the 4 or 5 different things that they have been kind of putting off, and now they're going to try to address that now. And it can feel
Hmm.
really overwhelming and lead to the provider not being very present with the patient, right? Because now we're thinking about,
Yeah.
okay, now I got two other 2 other patients are ready. The MA just messaged me and said that they're roomed now. The other one is frustrated and all of this. And now I can barely even listen to what's going on in the patient encounter, let alone like
Yeah.
empathize. And so a lot of this is going on. And I'd say the patients are understanding of it. And I don't want to use this as an excuse for dismissing the patient. I think we need a little bit more openness and honesty. And
Yeah.
this is where I've said in the past, hey, this deserves a lot more time and attention than frankly I have right now, and I can tell
Mhm.
it's important, and we will address it. I do want to address it. Maybe if I can do a quick, something to just help right now, but let's continue this conversation at the next visit because I do really want to address it rather than, "Ooh, okay, I gotta go, bye," right? We need a little bit more
Yeah.
openness and honesty about the system, like, our patients are real. They're real people too. So,
Yeah.
it's a little bit about what's going on behind the scenes. It's just there's always something going on. But I do think too, from a provider standpoint, to foster presence, I think we should be taught it a little bit better in school. We're not really taught how to
Yeah.
foster provider, but, "Oh, take
Yeah.
time outside of work and get your 8 hours of rest and take your time on the weekends," but what about what about the taking a deep breath before the
Mhm.
appointment? When you're scrubbing in, right, when you're getting some hand sanitizer, taking a deep breath before you go into that patient room, settling your
Yeah.
nervous and allowing yourself to just be present for a few moments, right? All the problems will kind of take care of itself, but this person right in front of you has their own issues and they're here today. And so I personally
Yeah.
try to take a deep breath. And in that deep breath, I try to visualize myself sitting on the exam table, looking at the door, right? Because
Mhm.
all providers are patients too. We've all been there too. We've all had health scares or had a family member that had a health scare, right? It's nerve wracking.
Yeah.
So it's something that we can all tap into. And so I find if I'm able to put aside everything, take a deep breath while I'm sitting on the exam table, I'm looking at the door, I can visualize the door, and I have my like concerns. I'm hoping someone's going to come in and help me. And that takes 5 seconds. That I'm
Yeah.
able to come in with a little bit more presence and empathy. It's not a perfect cure all to the burnout
Mhm.
and all that. I will admit, but there are little things that we can do along the way as well.
Yeah, I love that because I feel like I need to do that before walking into an appointment, or when I'm sitting there to like not feel so nervous or be like, okay, are you going to listen to me today? Or are you not going to? Like, how do I want to approach the situation? And I've never figured out how to do that. I'm like, you kind of do it on the fly because I want to see how you're doing first because I want to see, are you rushed when you come in? Do you have a lot of things going on? I've got a little bit more of like personal relationships with some of my providers that have been in my life for a long time where I'm like, how are your kids? What's going on? Or they'll come in and be like, I'm so sorry, I've got XYZ going on. I'm like, it's okay. Like, do you want to talk about it? Like, do you need something here? But I've cultivated that relationship with that provider. So I don't necessarily need that there, but the new providers that you have to go to, when I'm like, I've got this laundry list of problems. I had somebody come in and they were like, I could barely even look at your chart. I'm like, I understand. I get it. It's a lot. And this good story, but I had a provider come in brand new and I had been searching for somebody to take care of my IV medication because my one provider left and the person in the office was like, I'm not touching that. I'm like, cool, I need it to live. So somebody's got to help me here. And she came in and my husband was with me because it's a new appointment. I'm like, okay, I need backup. Like, I don't know what's going to happen. I left that appointment feeling like tearful in the best way possible, where I'm like, I've never felt more safe and validated than I did walking out of that appointment because walking in, you're ready for like a battle, right? Because you just don't know what to expect. And it's everything that you're saying is how she approached that situation and how she spoke to me. And a little bit of empathy goes so much further where we as patients are much more willing to maybe try something that maybe not that we're uncomfortable with it, but maybe it's not what we fully intended to like come in asking about. Maybe if we trust you, then we trust your judgment on a suggestion for something that we weren't so sure about. And this is just reminding me over and over again that that little understanding, that little bit of validation that you mentioned in the beginning, that you're like, in some ways, it sounds like fluff. It can make or break that relationship right then and there, especially if it's a first impression.
100%, 100%. Like I said, we kind of need to, the way I like to describe it is like a
Mhm.
bridge. Right? Like if we're trying to
Yeah.
get, if we if we can, even if we as providers feel like we know the path to recovery, right? If we just say, okay, here it is, but we haven't built the bridge for the patient to get there, then
Mhm.
there's no way to get there. And I think that
Yeah.
bridge is coming to an understanding, is validating and showing empathy, right?
Mhm.
And then we can also reinforce the bridge a little bit, right? Bring the
Mhm.
patient, help the patient. I mean, even get their input on the road to get there, right? In
Yeah.
collaboration. And this is something that I preach a lot too. And I know it for a lot of providers, it feels like, oh, this is just taking a lot of time. Is like, if I can just make the decision myself, that's a lot
Mhm.
faster. But if the goal is for recovery, I almost guarantee you it's gonna be slower because, again, you're not gonna have the patient buy-in. There's plenty of studies to back
Yep.
this up too.
Yep.
If you can collaborate with the patient, bring them in on their own care, you can personalize the care, right? Explain things, like you were talking about, hey, we might come in and not really be looking for a certain treatment, but then after discussing it a little further, we might be okay with it, right? It starts with one validation and understanding, but then bringing the patient along on that journey. Hey, not just, hey, I think, I'm going to send a referral to therapy. Like
Mhm.
that will land really poorly with a lot of patients if we
Yep.
don't talk about, "Hey, like, I'm hearing X, Y, and Z." And so
Yeah.
what I'm thinking is this could benefit you, I think, in these certain ways, but here are the limitations here. I'm not saying it's gonna help everything, and I'm not saying it's gonna cure, right? So being open and personalized, at the very least, even if you are wholly against it, you can
Mhm.
tell that the patient or that the provider is trying to think in your best interest, right? I don't know if you've ever received a comment from somebody that didn't land very well, and you were like, "That was weird, a weird thing to say, but I can tell it was good that, like, you were
Yeah.
well-meaning,
Yep.
and therefore I'm not, like, really that upset with you," right? Like,
Yeah.
um, so it just kind of yeah, it just kinda comes back to that empathy, that building that bridge, and then also collaborating with the patient and making sure that the plan is personalized, because that's just another form of making them feel heard.
Yeah, that reminds me of the "Have you tried yoga?" comment that we all laugh about now, but, it's that piece where I've had people, like, recommend something where instinctively I want to roll my eyes and be like, "Are you kidding me?" But, like, the tone, the person, the relationship I have with that person, sometimes as much as I'm like, "Are you kidding me right now?" I also realize that they're coming from a place of, like, I don't know what to do and I just wanna fix it, and this was the first thing I thought of. Like, it was meant with nothing but love and just the idea of wanting to help, but it's just it's so refreshing. It really is. Like, this is the most refreshing conversation because it sets a tone that what we have had in the past does not guarantee the conversations in the future. And if there's you out there and, the content that you're putting out on social media and the advocacy that you're doing for these communities, like if you're doing it, there's other people doing it. There's other people having these conversations. And as much as social media can be a black pit of doom and despair, no matter what subject we're talking about, there are these moments of real connection and real change that you can see. And I'm like, the more we keep talking about that, the more we have these conversations. I feel like I say that all the time, but it never stands to not be true that like it just you need to be more open to having the conversations and listening. And for patients, we have screamed into the void for so long that it feels hopeless. So just thank you for providing that hope that it's not always gonna be like that, and not every pain provider or person who deals in pain management is like, just, "Have you tried yoga?" or
Yeah.
"Have you wished it away?"
Thank you. I appreciate it, and it's something that it wasn't really something that I thought about when I first started
Mhm.
going into the online space, which felt awkward. I never wanted to be like an influencer or,
Me
to be,
either.
face forward with talking
Yeah.
into the screen, whatever, putting myself out there for,
Mhm.
the world to
Scary,
judge me
isn't it?
on a 30-second clip. Yeah, exactly. So I've learned a lot about myself and I've had to do a lot of self-work in the process too.
Same.
But there have been, impacts that I just never saw, people being like, "Hey, you give me hope that there are other providers out there that'll listen to me," right? And
Yeah.
this is something that I've seen in my work as well. I've worked pretty extensively with the unhoused population, and
Mhm.
that's another kind of passion area of mine. And I mean, talk about a stigmatized group of people. You're
Yeah.
unhoused, you're using substances, it's highly stigmatized, right? And so just treating them like a normal human being, talking with them, hearing
Yeah.
their needs and really validating what their experience is. And for some of them, it allows them to get for some of them, it's just, "Hey, I'm only ever gonna see you because
Mhm.
you're the bio," but for some of them, it allows them to get back into the
Yeah.
medical space and healthcare. And so I think it's, I hope that more providers will speak up. You don't need to post every time, every day, 3 times a day and try to get all the
Yeah.
but I feel like if there's a cause that you feel strongly about, really all you gotta do is pick up the phone, record, put it out there,
Yeah.
and you never know. It could change a life or even save a life.
Yeah. Well, I can say with complete certainty that you are already and have been doing that because like I said in the beginning, and I know I had said it to you previously, like it stopped me in my tracks where I was like, what did he just say? Hold on. Let me go back. And I'm like, okay, that's new. All right, let me see what else is here. And it's just more of that feeling. And it's just like I said, there's so many different things of being a patient that is difficult. There's, so many different avenues and roadblocks and all these things. And we come to social media sometimes and it can be really good and it can be super supportive. And then sometimes there's spaces where it's the who's sicker competition and you're like, is this all that there is out there? And then you have providers that are, sharing content that's informational, like, okay, good, that's really great. I want to save that. And then you have other providers that are giving content that like well that hurt my feelings a little bit, and then you've got the things in between and the more that in between and the more that we just keep doing this and like you said, showing up is not easy. Like this for me, I hate being on camera and I had the idea to do a video podcast. Why? I do not know. It has been the biggest growth period for me of like I have no idea what I'm doing half the time. I don't know why I'm like, I can't believe I said that, but here
Yeah,
we are. Let's just move on from that and call it a day. I can imagine you've probably had some of those moments too, but
percent.
you're changing lives. It might not feel like that right away, but I know that you are, and we just really appreciate that so much.
Thank you. I appreciate that, and you are too. I'm thinking by, again, it's like doing these uncomfortable things of putting our face on the screen is it's
Mhm.
just because we know that there are people that can benefit from the message that we have to share and the voices that we can
Yeah.
elevate. And I think that's a really cool
Yeah.
aspect of social media is not only sharing our message, elevating the messages of other people in the space,
Yeah.
and then learning from the community. That's been something that's been,
Mhm.
like talk about, me coming on here and like helping people. I would say that I've been heavily influenced by the community also coming into my comments, having a discussion, right? I try to
Mhm.
approach even some of the nastier comments with a little bit of curiosity. Where is this coming from? Right? Was
Yeah.
it something that I said? Was it something that I didn't say, which is oftentimes the case? And it's helped shape
Yeah.
my communication and helped me become a better provider, and just I think a better person in the space as well. And so social media, like you said, it can be pretty toxic. I don't love
Mhm.
it, but there is a lot to learn from it and from having these conversations, whether or not we're misspeaking and whether our hair is
Mhm.
done right and the lighting is okay and whatever
Yep.
else. Like at the end of the day, I think if we can be real and put out these conversations with the best intent, then only
Yeah.
good things happen.
Yeah, I know that I've definitely seen some things where I'm like, I can't believe that person said that. Like, I'm offended. Then I'm like, well, okay, hold on. Why am I offended? What about that piece of content or what they said or how they said it bothered me? And as I am putting myself out there, I know that the things that I say, the things that we say, the things that we share, we're not going to be able to be everything to everyone. There will be people out there that might not like what we say or how we say it, and that's okay. I'm happy to have a conversation very similar to what you said. Like I want to learn from you. I don't want to just say, well, this is where I stand and I'm done with that. I want to learn because that helps me be better for the next person, or maybe we each learn something from each other. And in all honesty, that's really what most of us want. We want to, like you said, we want to feel understood, but we also want to understand other people too. And I'm hopeful. The more I see things like this, the more of these conversations I listen to, I feel a little more hopeful every time that it's not always going to be the shit show that it is.
Mhm. Definitely, definitely, and it's always crazy to me when I see, like, in the comments, like, "Oh, I haven't met a provider in 20 years that has, like, heard me or understood me," and I'm working with these students that are coming up, and I'm like, "I would let this student be the provider to many of my patients because they
Mhm.
just do such a good job of hearing and understanding, and they wanna do well, and maybe that's just a partial product of not, being new to the field and wanting to just do their best and not being
Mhm.
old and jaded yet, right? But I do feel like, and maybe this is just the optimist in me, I do feel like a tide is turning. I think
Yeah,
that having more conversations about mental health and how to communicate, right,
yeah,
and kind of a byproduct of that conversation. And so I do feel like there's more training coming about for our upcoming providers and our newer providers, and even for
yeah,
the existing ones too, new training opportunities. And so, again, maybe it's just the optimist in me, but from what I'm seeing and my hope for the field, I do think that the tide will
yeah.
turn, especially with more conversations like these.
Yeah, I agree. I'm still jaded. I'm definitely still jaded, but I do feel a little bit more, when I like meeting a couple new providers that I have in the last few years where I walk away feeling safe. And I
Mm,
haven't always felt that way, especially with, multiple conditions and complicated treatment plans for these conditions. And, when I had one provider leave and I go see somebody else, they're like, we've never had anyone like you before. I'm like, not the first time I've heard that. So let me talk to you about this. Let me, like you said, be part of that plan. I can help you. I can help you figure this out because I've been doing this for a really long time. You're just stepping in. I understand that you're overwhelmed. My chart overwhelms me too. Like, I totally get it. So let's work on that together. And sometimes that fosters a wonderful physician and patient relationship. And other times it doesn't work. But, we live and we learn. And I've, figured out a lot of things by myself and learn to sometimes take my licks and walk out of the room a little bit disappointed. I hate to say that, but sometimes it's just what happens, and I think, how can I find something different the next time? Let's see what the next appointment brings, and if it happens again, okay, well, do I need to find a new provider, or maybe do I choose to be honest with this provider again and say, "Listen, I don't feel like you're hearing me when I'm telling you what's going on. So, can we adjust something? Are you not comfortable with my care? What are those next steps?" And that's something that we're hoping as we continue these conversations on, our side, to bring that to the patients too, to help give them some confidence in advocating a little bit more loudly for themselves, finding ways to be assertive without aggressive, because sometimes we just automatically want to be aggressive because we're in pain and we're pissed off. That doesn't always get us anywhere. So we have to find that happy medium of what works for us, what works for you. And it sounds like we're thinking of this beautiful world, and maybe at some point that'll be the norm, and the situations that we're talking about will be the anomalies, and I keep all my fingers crossed for that day.
mhm, 100%. And everything you said there, I feel like I go off on a tangent on 15 different things that you said there because one, you started off by saying, you feel safe. And it's not something that we really learn when we're coming up through school,
Yeah,
but, try healing from a place of not feeling safe and you're not going to get very far, right?
yeah.
We need to, we need to feel safe or somewhat safe. I think
Mhm.
before we can really start to heal, because if our nervous system is just on edge, if we don't feel safe, if we're feeling frustrated and torn down
Yeah.
and and not heard, not understood, I don't care what treatment you're going to throw at me. It's going to be very hard, unless it's maybe like a really strong, anti-anxiety medication, medication that's
Yeah.
controlled medication that's going to, you know, that's all jokes aside though. It's going to be really hard to heal from that space, right?
Yeah.
Um, and I loved what you touched on too of like, I'm coming in and be like, I feel like, and that's something that I try to talk to as well. It's unfortunate because we need a lot more education, I think, in communication from providers, if that's not painfully apparent and based on the first however many minutes of the podcast so far. But then the patients, it feels like you said earlier, feels like the burden kind of falls on them to like, I am the one that's so exhausted. Now I need to kind of like thread this needle of like being proper enough that's like presentable, but not
Mhm.
but not overly presentable to where they don't believe the symptoms that I'm saying, because then that doesn't match everything that's going
Yeah.
on. And but now I need to like communicate properly and thread this needle of like, okay, how do I express my anger and frustration without coming off as a difficult patient or combative, but while getting my
Yeah.
needs across. And that's not something we're very well trained for too. But you touched on one thing that I really liked, and that was the I feel blank because
Mhm.
blank, right? I feel blank when blank because blank, right? Using these I
Yeah.
statements. And that's a way of portraying the emotions, not saying, you are doing this, right? Saying I feel, you know, I feel
Yeah.
worried. I feel worried when my symptoms are dismissed because I
Mhm.
know something isn't right with my body, right? And that's a way of getting across what you're feeling without getting, letting the true emotions show and then backing them into a corner. Because we know if some of those come out, they might feel uncomfortable, right? Providers aren't
Mhm.
really trained very well for highly emotional situations. So they might just feel uncomfortable. But then just natural human instinct, if someone is kind of coming at you angry and mad, now we get defensive and backed into a corner.
Yeah.
And then that doesn't really
Yeah.
open up a dialogue either.
Mhm.
Patients are in such a difficult situation for so many of these appointments. And so I mean, obviously it's a two-way street, but I do feel like the weight falls on the patients more often than not, which is unfortunate.
Yeah. It's funny that you say that because I've said it a couple times. Like, I think I've said it in a few different episodes here, but in, just conversations with people where I'm like, I go into this appointment and I'm like, okay, so depending on the provider too, but it's like, so I need to be put together enough. So I'm taking care of myself, but not too put together. So you're not like, well, you look fine, right? I have to be smart enough that I understand the information that you're telling me, but kind of dumb enough so you feel like you're the smartest person in the room, and I have to tailor what I'm saying so you don't feel like I'm yelling at you for how I feel, but I also need to make sure that I'm getting my needs met by saying what I need to say in the most honest way possible. So it's that thing where we're having 10 conversations in our own head on how to communicate with you in the same way that you're having all these other thoughts of like, I still have this patient in like room 2, and then there's another patient in room 5, and I have to do charts for patients 1, 2, and 7, and I have to send in this prescription. Like, we're doing the same thing, but the outcome of what doesn't happen, for me directly impacts me. So I'm like, how do we
Mhm.
solve this? We could try to solve this today, but you know if only, but that's the whole point, right? That's the whole point of what you're doing on social media, what we're trying to do here, and coming back to how to tell your story in kind of tailored to the audience that you're trying to talk to, right? So you're not going to tell your friend how you're feeling the same way you tell your doctor. You're not going to tell your partner in the same way that you tell your friend, or a chronic illness friend versus, I'll say, a regular friend, So like you explain things differently. So it's like, how do we get the most bang for our buck on those skills? And those are skills that you have to learn that you never realized you needed to learn. And that's something I'm hoping that I'd love to solve it. I don't think we'll solve it, but maybe we'll get people in the next step forward. So that way, every appointment doesn't feel like a letdown, and every appointment doesn't feel like you weren't heard, in a way to speak up for yourself, feel heard, or at least feel proud of yourself for doing what, like, the most and the best that you could do in that situation.
100%. I mean, it's lifelong learning, right? And communication is so frustrating sometimes because it is a two-way street. We can't
Yeah.
really control what the other person is saying, thinking, or feeling.
Yeah.
And so, to your point about the provider, the patient has 15 different conversations, the provider has 15 different conversations. Oh, and they just got a, word that their kid is sick and it
Yep.
needs to be picked up from daycare. And how do I deal? We have personal lives too, and so
Yep.
it can be really difficult to manage that, and then you have to do all of that kind of fitting through these grooves of, okay, I haven't like, I've gotten this far in the conversation and, I have to do it all in a 15 minutes or 10 minutes or sometimes even
Yeah.
shorter. It's super difficult. We could go off on it probably whole its own podcast series. I'm sure it exists somewhere of
Yeah.
all the systemic things that we need to do to to
Mhm.
overcome that overcome that because
Yeah.
it is a real problem and it's not just one question, it's not just one answer, but it's a whole system of things. But
Yeah.
I do hope that in time we can slowly kind of unravel this mess of tangled yarn or whatever, and then,
Yeah.
make some kind of nicely knitted scarf. I just came up with that.
You're just reminding me that I need to get back to my crochet projects, for fun things to
Yeah,
do.
maybe I
But
need to put it on that. Yeah.
it is calming. It does help, calm the nervous system until I realize that I've done the wrong stitch for like 30 of them, and then I'm like, I'm done for a little while. But thank you so much for this conversation. I am very hopeful that m- good change is happening. I am, and I just really appreciate all of what you're doing. And I can't wait to share this conversation because I think we're going to get a lot of like, absolutely. And how do I find you? And where are you? And how do I get appointments with you? And all of the patients or all of the doctors that you are training, because that is what gives us hope of feeling like things are changing and we can't get rid of our chronic illnesses, but if we can find somebody to walk along the path with us, like we can be okay. Won't be perfect, but we can be okay. So thank you so much.
Mhm. Of course. Well, thank you so much for having me on here too, and to be able to have this conversation because it just felt as natural as could be. So thank
Yeah.
you for having these conversations. It really is a
Yeah.
pleasure being here.
Thank you.